When I'm working with people who have spinal cord injuries, there might be a couple of things that come up that tell me they may benefit from having therapy. And one of those things might be depression. And the way that depression is commonly seen is what's called anhedonia, or this decreased interest in things that are important to you. And so if I find that a person just isn't as interested in things that they would typically care about and that they're withdrawing, that to me is a pretty good indication that it's time to meet with them and talk about what's going on. And that's something, again, that's very normal in different phases of spinal cord injury, and that is not indicative of a diagnosis. It's a point for discussion to see how they're doing. Anxiety is something that may also be common. And if I say anxiety, it might be in the rehab therapies. And so what I'll do is ask if the patient wants to discuss what's going on in rehab that is challenging. Ask if it's okay if we bring in some of their other providers so we can troubleshoot what's going on in rehab. Oftentimes it's that fear of movement. Sometimes people feel very fragile after a spinal cord injury or surgery, if this maybe fear of falling or further hurting themselves. So it could be something as basic as providing education, or there might be some very visual reminders of the injury in therapy that can be anxiety provoking. And so addressing that from more of an existential approach, or meaning that what this means for my full life and who I am.